Today, let's talk about great revelation, insulin resistance, the silent root cause of major chronic diseases, why lowering sugar alone isn't enough. Introduction. 1. The unseen epidemic. Today, we are living in the midst of the greatest health epidemic in human history, not of infections, but of chronic metabolic diseases, heart disease, obesity, type 2 diabetes, fatty liver, dementia, even cancer. All share one silent root cause: insulin resistance. Dr. Ben Bikman, a metabolic scientist from Brigham Young University and author of Why We Get Sick, says it clearly. We don't get sick because of high glucose. We get sick because of high insulin too. Understanding insulin, the master metabolic hormone. Insulin is a storage hormone secreted by the pancreas. Its main job is to help glucose enter the cells for energy. Think of insulin as a key, opening cell doors for glucose to enter. When everything works fine, glucose goes into cells, energy is produced, and insulin levels return to normal. 3. What is insulin resistance? When we repeatedly consume refined carbohydrates, sugary drinks, processed foods, and live a sedentary lifestyle, our cells stop responding efficiently to insulin. The pancreas then produces more and more insulin to force glucose in. This is called hyperinsulinemia, chronically high insulin levels. Initially, blood sugar may look normal, but the person is already metabolically ill. This stage can last for 10-15 years before diabetes is diagnosed. 4. Epidemiology, a global metabolic crisis. Over 80% of adults in developed countries have some degree of insulin resistance. Even thin or normal weight people can have it, a condition called TOFI, thin outside, fat inside. WHO data: more than 500 million people have diabetes, and 1.5 billion are pre-diabetic, most unaware. 5. Pathophysiology, what happens inside the body. 1. Chronic sugar intake, frequent insulin spikes. 2. Cells become resistant to insulin. Glucose remains in blood. 3. Pancreas overworks, hyperinsulinemia. 4. High insulin, fat storage, inflammation, oxidative stress. 5. Over time, pancreas fails, blood sugar rises, diabetes. But the damage to heart, brain, liver, and vessels starts much earlier, during years of high insulin. 6. Insulin resistance and chronic diseases. System disease association, metabolic obesity, type 2 diabetes, fatty liver, cardiovascular hypertension, atherosclerosis, heart disease, neurological Alzheimer's, type 3 diabetes, cognitive decline, hormonal PCOS, infertility, erectile dysfunction, cancer, breast, colon, pancreatic, others, chronic fatigue, sleep apnea, inflammation. 7. The misguided approach, treating glucose, not insulin. Dr. Ben Bikman emphasizes, we've been focusing on controlling blood sugar when the real problem is high insulin. The danger of some anti-diabetic drugs. Many conventional diabetes treatments, especially insulin injections and sulfonylureas, lower glucose by increasing insulin levels. This gives a temporary illusion of control, but worsens insulin resistance over time. It's like forcing a tired horse to keep running by whipping it harder. Meanwhile, underlying metabolic dysfunction continues to progress, leading to weight gain, increased fat storage, worsening heart disease risk, beta cell burnout. Therefore, managing diabetes is not merely about lowering sugar, it's about lowering insulin. 8. The right way. Measuring and managing insulin resistance. Traditionally, only glucose is measured, but fasting glucose may stay normal while insulin is high. Tests that truly reflect metabolic health. Fasting insulin, ideal, 10 μU/mL, optimal 6. HOMA-IR, insulin X glucose, 405, ideal 1.5. Triglyceride HDL ratio, ideal 1.5. Waist circumference and visceral fat score. By checking insulin early, we can detect metabolic dysfunction years before diabetes develops. 9. Reversal and prevention. The empowered path. The best part, insulin resistance is reversible. Nutrition. Eliminate refined carbs, sugary foods, sweetened drinks. Prefer whole, low glycemic foods, vegetables, proteins, healthy fats. Include fiber and omega-3 fats. Try intermittent fasting or time-restricted eating, 12 to 16 HRs, physical activity. Engage in resistance training, walking after meals, and regular movement. Muscles act like glucose sponges, reducing insulin levels naturally. Stress and sleep. Chronic stress raises cortisol, increases insulin. Practice deep breathing, mindfulness, vagus nerve stimulation. Prioritize 7 to 8 HRs of restorative sleep, light, circadian rhythm, and nature. Morning sunlight resets metabolic rhythm. Evening blue light reduction improves insulin sensitivity. Gut health. Fermented foods, prebiotics, and probiotics modulate metabolism. Supportive nutrients. Consult professionals before use. Magnesium glycinate, vitamin D3, chromium, alpha-lipoic acid, berberine, curcumin. 10. Public health perspective. If every hospital, wellness center, and school began screening insulin, not just sugar, we could identify metabolic dysfunction decades before disease develops. Governments and healthcare systems should promote metabolic education, not just glucose control campaigns. Here are some important and serious health issues which need to be addressed urgently in order to bring down the occurrence of chronic non-communicable diseases of public health importance. 1. Insulin resistance and kidney diseases. Insulin resistance is increasingly recognized as one of the major underlying causes of chronic kidney disease, CKD, and chronic renal failure, both in diabetic and non-diabetic individuals. It disrupts the body's normal metabolic balance, leading to high blood glucose, elevated insulin levels, inflammation, and oxidative stress, which together damage the kidney's filtering units. The glomeruli. Over time, this causes glomerular hypertension, fibrosis, and progressive loss of kidney function. 2. Insulin resistance and mental health disorder. Insulin resistance, IR, is now recognized as a key metabolic driver contributing to major mental disorders such as depression, bipolar disorder, schizophrenia, and cognitive decline. The brain is an insulin-sensitive organ. Insulin regulates neuronal energy metabolism, neurotransmitter balance, neuroplasticity, and inflammation. When insulin signaling in the brain becomes impaired, neurons suffer from an energy deficit, leading to mitochondrial dysfunction, oxidative stress, and dysregulation of dopamine and serotonin pathways. These changes manifest clinically as mood instability, depression, anxiety, and even psychosis. Studies show that individuals with insulin resistance have a significantly higher risk of developing depression and cognitive dysfunction independent of diabetes, and that improving insulin sensitivity can enhance mood and cognition. 3. Insulin resistance and cardiovascular diseases, CVD. Insulin resistance, IR, is a fundamental mechanism linking metabolic dysfunction to cardiovascular diseases, CVD, such as atherosclerosis, coronary artery disease, stroke, and heart failure. When tissues become resistant to insulin, the pancreas compensates by secreting more insulin, leading to hyperinsulinemia, which drives inflammation, oxidative stress, and endothelial dysfunction. These processes impair nitric oxide production, reduce vascular elasticity, and promote hypertension and atherosclerotic plaque formation. In parallel, IR alters lipid metabolism, raising triglycerides, lowering HDL cholesterol, and increasing small dense LDL particles, all of which accelerate cardiovascular damage. 4. Insulin resistance and cancer. Insulin resistance means the body's cells don't respond properly to insulin, causing the pancreas to make more of it. This leads to high levels of insulin and blood sugar in the body for long periods, and both can promote the growth of cancer cells. Insulin acts like a growth signal, telling cells to divide and multiply. When too much insulin is around, it can overstimulate this process, increasing the risk of cancers such as breast, colon, liver, pancreas, and endometrial cancer. In addition, insulin resistance causes inflammation, oxidative stress, and hormonal imbalance, which damage DNA and weaken the body's natural ability to control abnormal cell growth. People with obesity, metabolic syndrome, or type 2 diabetes, all linked to insulin resistance, have a much higher risk of developing several cancers. The good news is that improving insulin sensitivity through exercise, a healthy diet, weight control, and stress management can help lower both cancer risk and cancer recurrence. 5. Insulin resistance and infertility. Insulin resistance means your body is making enough insulin, but your cells aren't using it properly, so your body keeps making more. This hormonal imbalance affects not just blood sugar, but also reproductive hormones, which can interfere with fertility in both women and men. In women, high insulin levels can lead to polycystic ovary syndrome, PCOS, a condition where ovulation becomes irregular or stops, making it harder to get pregnant. It can also cause weight gain, acne, and excess hair growth due to higher male hormone levels. In men, insulin resistance can lower testosterone and sperm quality, reducing fertility. The good news is that improving insulin sensitivity through a healthy diet, regular exercise, better sleep, and stress control can help restore hormone balance, improve ovulation, and boost fertility naturally. 6. Insulin resistance and eye health. Insulin resistance doesn't just affect blood sugar and metabolism, it also has a big impact on eye health. When the body's cells don't respond properly to insulin, blood sugar and insulin levels stay high, damaging the tiny blood vessels that supply the eyes. Over time, this can lead to inflammation, oxidative stress, and poor circulation in the retina, the light-sensitive part of the eye. These changes increase the risk of diabetic retinopathy, macular degeneration, glaucoma, and even dry eyes. Insulin also plays a role in the brain-eye connection, supporting nerve health and visual processing. When insulin resistance develops, the eye tissues get less energy and protection from oxidative damage, which can cause blurred vision and faster aging of the eye. The good news is that improving insulin sensitivity through a balanced diet, regular physical activity, better sleep, and metabolic therapies can protect eye health and prevent vision loss long before diabetes sets in. 7. Insulin resistance and weight gain. Insulin resistance and obesity are closely linked. Each one makes the other worse, creating a cycle that's hard to break. When you gain excess body fat, especially around the belly, your fat cells release inflammatory chemicals and free fatty acids that block insulin's normal action. As a result, your body needs more insulin to move sugar into cells, leading to high insulin levels, hyperinsulinemia. Over time, this causes even more fat storage and hunger, making weight gain easier and weight loss harder. 8. Insulin resistance and inflammation and allergic reactions. Insulin resistance affects not only metabolism, but also the immune system, increasing the body's tendency toward inflammation and allergic reactions. When cells don't respond properly to insulin, the body produces more of it, creating a state of chronic low-grade inflammation. This overactive immune response makes the body more sensitive to allergens and slows down its ability to fight infections properly. Insulin resistance also disrupts the balance of immune cells, increasing pro-inflammatory cytokines like TNF-A and IL-6, and reducing the activity of protective anti-inflammatory cells. As a result, people with insulin resistance often experience more frequent allergies, sinus issues, autoimmune tendencies, and slower healing. The immune system becomes confused, staying switched on when it shouldn't, and tiring out when real defense is needed. Improving insulin sensitivity through healthy diet, physical activity, stress reduction, and gut health support helps restore immune balance, reducing allergic inflammation and strengthening overall immunity. 9. Insulin resistance and muscular weakness and fatigue. Insulin resistance can cause muscular weakness and fatigue because it blocks one of insulin's key jobs, helping muscle cells take in glucose and use it for energy. When muscles can't absorb enough glucose, they don't get the fuel they need to function properly. Over time, this leads to reduced muscle strength, slower recovery after activity, and even muscle loss, sarcopenia. High insulin levels also increase inflammation and fat buildup inside muscle tissue, further disrupting muscle metabolism and protein synthesis. 10. Insulin resistance and fatty liver disease, NAFLD, and other liver problems. Insulin resistance is one of the main causes of fatty liver disease, NAFLD, and other liver problems. When the body becomes resistant to insulin, glucose can't enter cells easily, and the liver starts turning excess sugar and fat into triglycerides, which get stored inside liver cells. Over time, this buildup leads to fatty liver, inflammation, and scarring, a condition known as non-alcoholic steatohepatitis, NASH. If left untreated, it can progress to cirrhosis and even liver cancer. 11. Insulin resistance and lung diseases. Insulin resistance doesn't just affect blood sugar, it can also impact how well your lungs and breathing system work. When the body becomes resistant to insulin, it can trigger inflammation and oxidative stress throughout the body, including in the lungs. This can make the airways more sensitive, increase mucus production, and reduce lung function over time. People with insulin resistance are more likely to experience breathing problems such as asthma, sleep apnea, or reduced lung capacity. Over time, insulin resistance can also affect the muscles involved in breathing and lower the body's ability to use oxygen efficiently. This means even everyday activities may feel more tiring, and recovery after exertion can be slower. Improving insulin sensitivity through lifestyle changes, like regular movement, healthy eating, and good sleep, can help support better respiratory health and overall well-being. Key takeaways. Managing diabetes is not about controlling sugar, it's about controlling insulin. Insulin resistance is the soil in which chronic diseases grow. Reverse insulin resistance, and you reverse aging, inflammation, and disease risk. Thank you. Holistic Wellness Foundation, IMFAL. Healing beyond the boundary.